talking about healthcare in a semiconductor and electronic space is something that we have been talking about and is quite a close to our subject for all of us. The things that I want to talk today is very brief, and a couple of things I want to touch on that what we miss upon most of the time. And that's the reason that industry in India, especially the medical devices in industry, at a very nascent stage is not growing at the rate it should have been grown. Can you just move the slide? Yeah. What we one thing always forget when we talk of healthcare scenario in India, we try to create one common framework for Indian healthcare, and that's where the first mistake starts. If you see India today, we always talk of India and we talk of that India number one, and that's where we all concentrate upon, and that's a quite overserved market. Is a high-priced, high-quality healthcare available and delivered. But unfortunately, all our research, all our efforts gets diverted towards that market only. But that serves even less than 100 million population of the 1.2 billion. Now, coming to the crux of the problem here is that the life cycle cost that gets incurred in this kind of healthcare is not really affordable for most of the people of the country, and that's where the problem remains. So if you see the development of devices or development of service delivery, what has happened over the last 10 to 15 years in Indian context is primarily driven by North American and Central European models of healthcare delivery. And that's where the problem lies today. And once the healthcare delivery is driven towards the model of Northern America or Central Europe, our R&D also got focused in that direction. We always went on harping on our SNRs and our image qualities, and we added slices and slices in the cities, but we never thought of who is going to use that in this country. So that's the starting point of the problem. If you come to the second part of the economy, what we call India number two, the aspiring middle class, about 200 million population, which has the money to spend now, but the problem here is completely different, access. Because these 200 million people, most of them don't live in the major metros, but they live in some cities which doesn't have much access. So what happens, though there is affordability towards the healthcare, but healthcare delivery doesn't reach. And we never thought of, if you see the last 10 years of our research and last 10 years of our developments, we never thought of a problem that there will be people, but there will be no doctors to serve them. Because we have shortage of physicians, we have shortage of clinicians, and nobody wants to go to a tier 2 city when there is enough opportunity available in the tier 1 city. So how do we bridge that problem? How do we get a technology bridging the problem that where affordability is there, but physicians are not available? And the last but not the least is that about 750 million people which lives in areas where healthcare delivery is almost not available, even today. Some efforts were made over the last 5 years through NRHM missions, but most of them were not really that successful, and that's where the biggest problem lies today. So when you talk of future healthcare delivery and our research towards the healthcare delivery, we need to keep all these three aspects of the economy in mind, because the requirement, the research which goes into the tier 1 or the India number 1 is not required in India number 3. When you go to the India number 3, probably the connectivity is the most important thing. But if you see the devices that has connectivity is the most expensive levels of devices which get sold in the India number 1, where probably you can get 3 physicians for 1 patient. So that's the paradox today. Yeah. Now, other thing we always keep forgetting is that what is we want to solve? What is that we wanted to solve over the last 15 years? And somewhere we lost in the whole paradigm is that what is the disease that exists in this country? We tried solving the problems of diabetes at some point of time. We tried solving cardiac at some point of time. But If you see the overall spectrum of solution that came out in this country, what we worked on in the last 15 years was not really focused on the propensity of the problem. We never talked of, in general, the maternity as a big problem in this country. And even today, if you see the maternal mortality is quite high. And even among the BRIC countries, if you see the maternal mortality is still high. Infant mortality we don't want to talk of in a public forum. So that's probably one of the things which got missed out completely. And when you talk of this maternal mortality, infant mortality, the most of the mortality happens in the India number 3, where 750 million people lives in. And there is no healthcare delivery there. So what is the basic research that would have been possible? What is the basic research which would have been helpful for the country, which got missed out because we are never focused that which disease is prevalent in which part of the economy. And that's very important to understand when you go forward in future research so that you don't do the same mistake again. Because if you see the lifestyle disease, we are very focused on lifestyle disease management today because that brings the maximum revenue for the hospitals. And the lifestyle disease is primarily concentrated in the tier 1 metros. And that's an overserved market already. And more research goes into that. Now, unless there is a intervention by the research bodies, we'll keep on doing the research on that, which will serve about 100 million people, which is fine, but there is 1.1 billion people who will not get any benefit out of it. So we just keep the context of the economy and the disease in mind before we go forward for any of our research. Otherwise, 95% of the research papers will be lying in the drawers of the universities only, will never see the light of the day. Now, looking at the medical industry at a glance, I don't want to throw the numbers, but it has a potential to grow up to $2.5 billion over the next couple of years, and we are seeing the first growth rate, about 23% growth rate has recorded consistently over the last couple of years. So what I wanted to impress upon all of you is that this is a good industry to focus on. This is a good industry to invest on. This is a good industry to put your research on, which will bring revenue in the future. And the factors are obviously the affordability is going up in the rising middle class. Awareness of healthcare is better, and investment in health infrastructure is coming up finally both at the private and the government level. The biggest problem of this industry is high import dependency. Even today, we import about 90% plus of the equipments and consumables from outside the country. And that's not really healthy for an economy which is growing at a 23% rate. The couple of things which is crippling the industry is that the basic absence of a regulatory framework for medical devices industry in India. Today, if you know, the industry is as bad as that anybody can manufacture anything at any corner of the world and come and sell in India. And that's not acceptable about 95% of the countries in the globe. So we belong to those 5% of the countries in the globe having 1 billion plus population and having a market potential of a couple of billions, which doesn't require any regulation to sell anything. So anybody can create one junk and come and sell. On top of it, we have a very anomaly in the tax structure. If you look at the tax structure in detail in healthcare industry, you will see it is cheaper to import than manufacture in India. If you want to import the parts, you will end up paying a much higher duty than if you import the full machine. So these are the couple of things which is really crippling the industry over the last 10 years. It's getting eased out, but still we need to keep looking and keep talking on that so that we get to the right point in near future. Another important thing is that public healthcare system is a very important thing in any economy, be it Central Europe or UK or US. So public healthcare system need to have a roadmap, and that need to be known to the researcher where you want to take the public health system. And once that is known, the investment towards the research to the public health delivery will be much more effective. Going forward, again and again, standardization is required, regulation is required, and that will lead to the global acceptance, because today the Indian manufacturers face the biggest problem. Even if he manufactures something, nobody wants to buy from him because he manufactures in one corner of India and he can sell and make it without following any regulation. So when he goes outside India, nobody even wants to talk to him. That's a big problem. The strong revamp of the public health system, which is crippling, we need to really look at that, and we need to have research focus towards that. And again, coming back to that 3 worlds within India and 5 disease profiles, which goes to which market, and looking at that relevance before we invest on research, that will make the things much better. And obviously, tax and duty structure, we keep talking in all forums. It has been much better over the last 5 years, but still a long way to go. Thank you.